Number 20, please.
Thank you, Mr Speaker. The Department is committed to delivering an improved benefit system for claimants that are nearing the end of their lives and is working across government to bring forward proposals following the evaluation. I remain committed to implementing the key areas identified as soon as possible.
Emma Harder.
Thank you, Mr Speaker. I have a constituent with incurable mantle cell lymphoma who doesn't meet the definition of terminal illness. She's been refused PIP. She's 1 year off her state pension, and because she owns a property which her disabled son lives in, she can't claim means-tested benefits, and she is in a dire financial situation. How much longer will she have to wait for the rules on terminal illness to be changed?
I thank the honourable member for highlighting this. Whilst I don't know all of the details, I'd be very happy if she's willing to share those details to look into that specific case. But it does highlight the importance of why we've carried out this vital evaluation, supported by stakeholders, and the key three principles of improving awareness, consistency and scrapping the 6-month rule are something that remains a priority for our department. Building on our COVID response PIP2 online service, whereby claimants can receive and submit their PIP2 online, we are in the early stages of developing a new end-to-end application process and plan to test that later this year.
Matt Vickers.
Thank you, Mr Speaker. As we return to normality, what steps are being taken to ensure that PIP claimants are assessed promptly so that those in need of support can access it as quickly as possible?
I am conscious that my honourable friend has raised some specific cases directly with me, and as we return to normality, we have received more claims than normal. We're working hard to get through these as quickly as possible, with average clearance times slightly up from 16 to 19 weeks. As face-to-face assessments start to return, those unable to be assessed through paper-based reviews, telephone or video assessments will be prioritised.
Baker.
Thank you, Mr Speaker. I welcome the DWP's commitment to delivering an improved welfare system for people with a terminal illness, and I hope that this can be delivered very soon. Can my right honourable friend confirm that the proposals to change the special rules will not be included in the upcoming Green Paper, which will result in further delay and is unnecessary, as the DWP has already consulted stakeholders?
Thank you, Mr Speaker. My honourable friend is absolutely right. The SRTI evaluation has been completed and will not need to be rerun through the forthcoming Green Paper.
Let's go to Steve McCabe. Steve.
Thank you. Will the Minister be recommending to his colleagues that they purchase and read the recently released e-book, Brown Envelope, containing more than 200 poems, pieces of prose and short plays about disabled people who say they've been brutalised by the bureaucracy of the Department of Work and Pensions?
As a government, we are rightly proud of providing record amounts of support for people with disabilities and long-term health conditions. In our forthcoming Health and Disability Green Paper, we will be looking to work with stakeholders and those with real lived experience to make sure we improve the services and support that we provide.
Robert Logan.
Thank you, Mr Speaker. Tomorrow I'll be hosting a workshop between local disability and support groups and the DWP in my constituency to discuss the Green Paper. Ahead of that meeting, could the Minister update the House on what steps are being taken to increase access to benefits and support for the most vulnerable people during this pandemic?
I thank my honourable friend for being so proactive, along with about 50 other MPs who've already agreed to host a Health and Disability Green Paper to look at the key themes around advocacy, getting supportive evidence, the assessment process and the appeals process. This government makes it our absolute priority to support those with disabilities and long-term health conditions.
Who had a jab recently, had a nasty reaction and couldn't go to work the following day, then found she'd lost 10 hours' pay, half her week's wages. That's the world of precarious work. It certainly doesn't encourage people to have a jab. So what can the government do to rectify this situation?
I thank the honourable member for raising that. We have been improving guidance and sharing best practice with employers. We've also made changes to the statutory sick pay for those who are either self-isolating, are sick, or are offered so that they remove the 4-day waiting list. It's disappointing to hear of how that specific employer has treated their hard-working employee.
Let's go to Speaker. This government is focused on getting more people into work through our ambitious plan for jobs.
However, last week I was contacted by a constituent in Redcar and Cleveland who's a qualified primary teaching assistant looking for work. She told me that every time she declares her autism and epilepsy, sadly, employers decide not to pursue her applications further. What more can the government do to encourage employers to give differently able people, like her, the equal opportunity of work?
Thank you, Mr. Speaker. My honourable friend highlights a vital issue, which is why we have developed a disability confident toolkit developed with stakeholders to provide comprehensive information and guidance for employers on autism and hidden impairments, and I hope her undoubted talents will be unlocked shortly.
Thank you very much, Mr. Speaker. My constituent, Martin Burnell, is living with motor neurone disease, which is a progressive terminal illness for which there is no effective treatment or cure. Earlier this year, he was told to reapply for his benefits or risk having them stopped. Will my right honourable friend commit to removing the burdensome and unacceptable requirement under the special rules that people with a terminal illness have to reapply for their benefits after 3 years?
Thank you, Mr. Speaker. As part of the Green Paper, we will be going further than the SRTI evaluation to look at the principles of extending the severe health condition criteria to remove unnecessary assessments and reviews.